joins World Hepatitis Day 2025 observance. Delhi's Model Treatment Center under National Viral Hepatitis Control Program holds Hepatitis B and C awareness rally. RIMS Director Professor G. Sunil Kumar Sharma inaugurates Manipur's first biometric-based blood donor management system at the Department of Transfusion Medicine. Combined security forces recover 100. World Hepatitis Day 2025 observance. Health Director calls for collective action to eliminate hepatitis by 2030. RIMS Director Professor G. Sunil Kumar Sharma inaugurates Manipur's first biometric-based blood donor management system at the Department of Transfusion Medicine. Combined security forces recover 155 weapons and 1,652 rounds of ammunition from Churachandpur, Frizol, Kangpokpi, Chandel and Technopol districts. And continuous rainfall since last evening causes flash floods in several parts of Imphal city, causing major inconveniences to commuters. Locals demand permanent solution. Hello and welcome to Impact News. You're watching Primetime English Bulletin. I'm JOYSHREE USHAM, bringing you the top stories and latest news at this hour. Amju and EGM continue black badge and slogan protests demanding justice over the Gwaltabi incident. Manipur government break the silence over Gwaltabi. Moving ahead with today's news, Manipur joins World Hepatitis Day 2025 observance. State-level observance was held at Hotel Imphal on the theme Let's Break It Down. Directorate of Health Services, Manipur National Viral Hepatitis Control Program, SHS and National Health Mission jointly organized the event. Speaking at the event, Director of Health Services Dr. Chambo Gonmei stressed that hepatitis remains a silent yet deadly disease that often leads to liver failure and deaths if not diagnosed early. He said that awareness, early detection and timely treatment are critical to combat the disease. He added that 5 types of hepatitis exist, with hepatitis B and C being the most dangerous. Both are treatable. Treatment facilities are available at RIMS, Jenims and district hospitals across the state. Highlighting the global goal to eliminate hepatitis by 2030, Dr. Gonmei urged health workers and stakeholders to intensify efforts in prevention, screening and awareness campaigns, especially in vulnerable communities. The event also recognized the best performing districts and institutions. Ukrul received the award for Best Hepatitis B and C Treatment District. Taubal was awarded for Best Screening and Testing, and Imphal West District for Healthcare Worker Vaccination. Churachandpur District was honored for excellence in MIS Porter entry under the National Viral Hepatitis Control Program. The program was attended by top officials including State Mission Director NHM Dr. M. Dinesh, Director of Family Welfare Services Dr. N. Hemanta Kumar, Project Director Max Shamim Ahmad Shah, RIMS Director Dr. G. Sunil Kumar and Jenims Director Professor Longjam Usharani, along with doctors and nurses, representatives from NGOs and healthcare workers from across the state.
It is the will of our health workers to eliminate this by 2030. Let us all work hard. Let us all put our efforts in giving awareness to the people, the society, the community, even the health workers also. Many people are ignorant. I like to insist on all the people that there is a center for getting this vaccination for hepatitis B. So let us try to get this vaccination. In Ardewing, we are having this now. We have a center there for the health workers, high-risk groups, and those who are suffering from, say, HIV. And those people we are giving free of cost. So for the public, as of now, we are yet to give free vaccination. If they want to, they can go to the private institutions, get it vaccinated by paying some amount of money.
Jennings Model Treatment Center under National Viral Hepatitis Control Program today organized an awareness rally as part of World Hepatitis Day observance at the hospital campus. Speaking on the occasion, Jennings Director Dr. Longjam Usharani stressed the importance of early detection and timely treatment of hepatitis B and C to prevent complications. Highlighting the silent spread of the disease, the director urged people to get tested and treated without delay. The event saw active participation from Jennings MS, Dr. K.H. Lokeshwar, faculty members, doctors, nurses and staff.
Asigi World Hepatitis Day si pangtokpai thoram chida thoram macha ama sindana rally amaga loinana mayamda viral hepatitis laidiba makal singchi khanganaba amsung thingnanaba amadi matungda hena sandoktanaba hotnabada mayamda paujel piba oina ngasigi rally siga loinana function asi sinbani
hepatitis haiba makal hepatitis C B mayam si ngakthoknabagi damakta ekoina mipum khunimak paujel si pihodrgadi tungi manglam chata akoigi yamna waba porkodoba aduna khudingmakki laina se masibu control tawnaba thingjenabagi damakta akoigi maraksi discrimination amabu mu khandoktana tamba khudingmaksibu ngakthoknabagi damakta lek break
Marking World Hepatitis Day, Institute of Liver and Digestive Science ILDS Kwakatel Hainokhongnembi today organized a liver health camp offering liver health package, free consultations along with the World Hepatitis Day Marathon 2025. ILDS Director Dr. N. Suraj Kumar warned that hepatitis B and C are major causes of liver cancer. He said out of 5 types, hepatitis A, B, C, D and E, hepatitis A and E spread through contaminated water and stressed the importance of clean water and hygiene. Under the theme Hepatitis, Let's Break It Down, ILDS since yesterday has been offering free OPD consultations, lab tests for hepatitis B and C along with screenings in gastroenterology, cardiology, endocrinology, fibroscan and ultrasound. A total of 633 patients received services. Community Network for Empowerment CON General Secretary R.K. Nalinikanta expresses concern over how to achieve the UN target of eliminating hepatitis by 2030, as 90% of drug users in the state are still unaware of their hepatitis status. CON and RIMS Psychiatry Department today jointly observed the World Hepatitis Day at the department's Dr. Kamal Hall. Speaking on the occasion, R.K. Nalinikanta emphasized that modern direct-acting antiviral DAA drugs are very effective in treatment of hepatitis B and C. He informed that around 40 lakh people are infected with hepatitis B and 8 to 10 lakh with hepatitis C in India. He maintained that since 2014, CON has conducted widespread testing through outreach programs across Manipur. Out of 13,000 drug users tested, 43% were found positive for hepatitis B and C, and they were given treatment.
Breakdown talk to Kemta, Nati patients in a line testing Natragada treatment services in the loan and mechanisms are going to put over never break it down and Moina. Panbiram is a testing, vaccination, treatment, assess to was simplified to Kopiba, Adagiti drug user population, Arige Consalaga, screen Tautoga treatment, Tautopina, Honaba, Sineva, Timsiki, Nungi, idea, the state government, Honabi, but again, national program, Laktana Mayanda, Soba, Assam, the PB, Mayamgi, Assasima, Pumpana, Navagi, Tamaka programs. Hospital da laga khaktang service logadabani haibasi natabi moongda masagi result toragasu laidiba service sing yohollaga testing amadi treatment uptake ki sangse wanghalan ba yage haibedu so ei yengan janingi adana national program gi khutta loina ba rely tawmani na initiative se kitang tongan ba approach ama lauraga koigi elimination gi pandam se phangminasi.
RIMS Director Professor G. Sunil Kumar Sharma today inaugurated Manipur's first biometric-based blood donor management system at the Department of Transfusion Medicine. Developed by RIMS IT cell, the system aims to prevent illegal donations, ensure a 90-day gap between donations, help curb commercial blood sales, and improve screening for hepatitis B, C, and HIV. The system ensures greater safety, traceability, and discourages professional blood donation practices harmful to public health. Federation of Indian Blood Donors Organization Manipur President Pradeep Morangthem stated that RIMS biometric-based blood donor management system is the first time to be introduced in Manipur. He urged that similar system be extended to other hospitals. Combined security forces comprising the Manipur Police, Assam Rifles, Army and CAPFs have recovered a huge cache of arms and ammunition from various hill districts of Manipur. The recoveries were made following coordinated intelligence-led search operations over the past few days. According to police, the operations were carried out simultaneously at multiple sites in the interior regions of Churachandpur, Frizzol, Kangpokpi, Chandel and Tengnopol districts. The joint operation teams recovered a total of 155 weapons, including 8 AK series rifles, 14 country-made pistols, 14 12-bore guns, 8 9mm pistols, 31 Pompey guns, 21 single-bore guns, and 1 sniper rifle equipped with a telescope. Other recoveries include INSAS SLR, M4.22 rifles, carbines, grenades, and single-barrel and bolt-action rifles. Security forces also recovered a staggering 1,652 rounds of ammunition, including 39 IEDs, 13 hand grenades, and 1,600 assorted rounds. Additional items recovered during the raids include 4 binoculars, 15 communication sets, and 1 telescope. Briefing the media at the police headquarters in Imphal today, IGP Intelligence Ningshen Warngam reaffirmed that Manipur Police is committed to restoring peace and normalcy in the state and call upon the public to cooperate by reporting suspicious activity or information regarding illegal arms. Police said these operations would continue in a focused and sustained manner to safeguard public order and ensure the safety of all the citizens.
This continued intelligence-led operation in the Hill District represents a major accomplishment for Manipur Police and other security forces in our continued mission to restore peace, uphold public order, and safeguard the lives and property of citizens. The Manipur Police reaffirm its commitment to fostering a peaceful and secure Manipur. The public is urged to cooperate with the police, Assam Rifles, Army, and other security forces, and to promptly report any suspicious activity or information related to illegal arms to the nearest police station or central police control room.
The ongoing indefinite ban on the movement of Kuki people in Naga-inhabited foothill areas of Manipur, imposed by Foothills Naga Coordinating Committee (FNCC) against illegal construction of German and Tiger roads, setting up of Sioux camps and poppy plantations in Naga areas, has entered day 10 today. Security forces are keeping strict vigil to prevent any untoward incidents as protests intensify in Kangpokpi, Tamenglong, and Nonne district. The indefinite ban was launched on July 18.
Ngasi FNCC committee na adamay na tathari ba ngasi bansin no may trahe na sukre ado phao baso government si yeng biday government kari khali bra noi government atumba wa don hoi su ngang biao government hoi tom do na lai bra noi kanari mitang tang bra noi kari khali bra ngasi akwai lantaw ba asiana thona din hoi dai po ngam kira noi na dai po da na government subgen thamni ba thamba aduga moi na toning ba taw do na lai bidu akwai di yani dai.
Continuous rainfall since yesterday evening has flooded roads in parts of Imphal city. Although water level in rivers has not risen significantly, roads have been waterlogged, causing huge inconveniences to commuters. Road and houses in Kakwa Asem Lekai have been waterlogged. Speaking to Impact News, a resident Asem Mani stated that the area is prone to flooding whenever there is rainfall. He highlighted that the sewer and drainage cannot contain the runoff water, resulting in artificial floods. He said the people had sought intervention from MLAs from time to time. However, a permanent solution is still lacking. Locals are now urging the authorities to take immediate action and improve the drainage system to prevent further floods.
Masi ako na hayung mudi mo ako gi langban kende emile jo ko ka hajar hamne ko summa ahing nong tabla sorok thumba adin lala simbi da ba anjan ha simbi dire ba aduna dum thumbe ko hoji ju sumang de sing le hui pum pham bai teu je adung ja wa bo re ba ko je je loi lambi nung bi loi thumbi ne je akam ba kha jumam le je sinatna sumang si yo khu yo li bo je nala sila matik cha na ji sem ta sing je thumo ya ba nala ba ja sem ta lai tre ba sorok ti sing chele sorok sin nala wa re I modally, as in a lazy Pumasa, Nala Punim at the Madi, sing Ilamje, Aquina Canum, Amoga Kotoso, Zara Selemego, Simanung sing Ilam songs out sing by M. Jingle, Nala this arm of Semego. Others see sing to Makolas, Punjantamina, I don't block down never.
Takhelambam Lekai Road along the Tidim Road has also been waterlogged. A local of the area, Soram Thoiba, told Impact News that the water flows into Waisel Maril. However, poor condition of drainage prevents the water to flow freely into the stream, causing rainwater inundate the road. He continued that residents have raised the level of ground in their houses, but still water seeps into the houses of those who cannot afford to raise the ground level. Houses in Kashampat, Kangabam Lekai have also been flooded. Students of Lumding Higher Secondary School carried out a protest demonstration today over non-disbursal of salary for newly regularized lecturers. Students raised several slogans and held placards carrying which read such as empty classroom, empty future, and we want regular classes, among others. A student of class 11 science, Angelica Sorokaibam, said that the pen-down strike by Lecturers Association Manipur 2018 batch has disrupted normal classes in the school. She appealed to relevant authorities to resolve the issue at the soonest. Now with that, it's time for a small commercial break. After the break, we bring you news on Fast Track Court's number 1 convicting a man in sexual assault case of a minor girl. Keep watching Impact News.
Khanganjava Impact TV ki nungsijaraba local cable operator LCO singi mafam da khanganjari madudi thagi pifam thokpa bill tang tara manga fawo gi manung da pithokpiu kaigumba tang tara manga fawo da bill thido haudrabadi tang tara taruk tagi disconnect tawba haujaragani loinane Impact TV bu nungsibiduna miting tabiriba subscriber singna su thagi bill tang tara fawo da isa gi mari leina ba LCO singda pithokpina ba ningsingjari khanganjari ba manager Impact TV.
Welcome back after the break. You're watching Primetime English Bulletin. Fast Track Court's number 1 has convicted a man in sexual assault of a minor girl. The convict has been identified as 22-year-old MD Abdul Rahman alias Ibomcha from Bishnupur district. The heinous crime was committed in November 2013. Sentence hearing is on July 30. At least 6 individuals, including 3 siblings, were injured in a stabbing incident near Sora Kaitel under Kakching police station last evening around 5:30 p.m. According to police, injured persons are 28-year-old Makak Mayum Amar, his brothers MK Akbar, 26, and MK Asif, 24, from Sora Chingwangma. Others are 24-year-old MD Anash Khan and his father, MD Iboyai, 45, both from Sora Mamanglekai, along with MD Mustakim from Sora Awanglekai. 3 of the injured were admitted to Thawal District Hospital, while the rest were taken to Jivan Hospital in Kakching, Lamdong. Later, they were referred to hospitals in Imphal due to the severity of their injuries. Kakching police has registered a case and initiated investigation into the incident. Proscribed Kanglei Park Communist Party People's War Group informs that Oinam Langamba Elias Moranjao has been banished from the outfit. A press statement issued by KCP Lamyanba Kuman Piaro Chingkhainganba informs that 45-year-old Moranjao from Thanga Karang Mangal Makong has been banished from the group for tarnishing the outfit's image by meddling in private matters and carrying out extortion against the outfit's decorum. RPI Delhi Youth Wing spokesperson Oinam Swami says prevailing Manipur situation is due to difference of opinions among the state leaders and he calls for unity. He was speaking at the reception of Maheshwar Thanaujam, who has been reappointed as National Secretary of RPI Atawale. The reception was held at the party National Secretary office in New Delhi.
Hojik lairiba laibak asida khoi representative oina khoi phokpirakliba bioi singsina magi mai mot tinadadana khoi kangkhong saiba state ama khoi na uba phangliba si mot tinadaba se punna tinaraga khoi khumang sausen ba state ama oibada khoi punna hona minasi have se khoi miyam ama sung RPI Delhi Youth Wing gi mahut sanjaraga hangna khoi khamjari.
Monday, mental health counselling was held at MB College in Imphal today. National Health Mission Program, Telemanas CDS, Manipur University, Yawol, the Youth Network and the College IQSC jointly organized the event. Thobal District Hospital Senior Psychiatrist Dr. K. Robindro, State Telemanas Cell Clinical Psychologist Dr. Karishma and Yawol, the Youth Network Counsellor and Vidya Lakshmi, MB College Principal Dr. Bhavananda among others attended the event. 5-day workshop on low-resource speech technology wrapped up at NIT Langol today. The workshop was organized by Konthok Lon Lab at the NIT Manipur Department of Computer Science and Engineering. HOD Computer Science and Engineering Dr. Yambem Jina Chanu graced the valedictory event among others. One-day awareness on drugs was held today at Hyanglam Hiranmai under Kakching district. The awareness program was carried out by Hakchen Kanglon Thangta Sindam Sang. The program was graced by Kanglei Pana President Ilangbam Ongbi, Abem Pishak, Kanglei People's Confederation Secretary Kate London and Kanglei Pana Advisor H. Laikomba among others. One-day Convergence Mela with stalls from 25 departments was held at Ibudho Sangsang Ningthau Shrine in Ningombom today. Langtabal Ningombom GP PRIs, Salai Tared VLF, Ningtibi Laikol VLF, Mangal Lema VLF, Nongin VLF and Apunba Mangal VLF jointly organized a fair under Manipur State Rural Livelihood Mission. Bangladesh Manipuri Sahitya Sansad celebrated its 50th Foundation Day at Saroda Hall, Sylhet today. Manipuri Sahitya Parishad President L. Birmangal from Tripura was conferred with Nilima Sinha Memorial Award 2024 at the event. The award donated by Nilima SK Sinha Trust includes 20,000 rupees in cash, citation, shawl and memento. It may be mentioned that L. Biramangal is the fourth person from Manipur to receive the Nilima Sinha Memorial Award after Sarachan Tiam and Tombi and KSH Bira. Both houses of parliament faced repeated disruptions today as opposition protests intensified over the Special Intensive Revision SIR of electoral rolls in Bihar. The Lok Sabha was adjourned 3 times while the Rajya Sabha barely functioned for 5 minutes before being adjourned for the day. Opposition members demanded a discussion on the SRI exercise alleging irregularities and seeking government assurance. Despite the protests, the Lok Sabha managed to begin the scheduled discussion on Operation Sindoor and the Pahalgam terror attack. A similar debate is expected in the Rajya Sabha tomorrow. Home Minister Amit Shah, Defence Minister Rajnath Singh and External Affairs Minister S. Jaishankar are slated to speak on the issues with indications that Prime Minister Narendra Modi may also intervene to highlight the government's national security record. As both houses adjourned amid the standoff, the log jam threatens to further stall proceedings in the ongoing monsoon session. Now, before we end, let's take a look at the headlines once again. Manipur joins World Hepatitis Day 2025 observance. Health Director calls for collective effort to eliminate hepatitis by 2030. RIMS Director Professor G. Sunil Kumar inaugurates Manipur's first biometric-based blood donor management system at the Department of Transfusion Medicine. Combined security forces recover 155 weapons and 1,652 rounds of ammunition from Churachandpur, Frezol, Kangpokpi, Chandel and Technopol districts. And continuous rainfall since last evening causes flash floods in several parts of Imphal city, causing major inconvenience to commuters. Locals demand permanent solution. That's all we have in this bulletin. Thank you for being with us. Coming up next is Primetime Manipuri Bulletin. Have a great evening and stay safe.
Soikiva Kongtang Amada, Sirin Sama share Domina.